I want to touch for a minute on the mental health workforce. And I'm really excited. My older son is starting a master's in social work program in June at Smith College. And it's been just an amazing journey to help him navigate to deciding that this is the path for him to become a therapist. But it's come with some consternation when we look at the structure of the program. And it's a wonderful program, but still they are expected to do 2 8-month practicums or internships. Generally, they're not at all paid. Maybe you get a little stipend. And so for students, they have to take on the expense of the graduate program itself, and then the expense of working for free for almost 2 years. And then you enter the workforce. And as you've pointed out, many of these students can't kind of afford to get licensed because those requirements are so substantial. And yet we know that there's such a dire need for people who are trained to be therapists and social workers and psychologists and other kinds of lay positions to support our mental health. 1 out of 3 communities doesn't have access to the workforce they need. And I first want you to talk a little bit about this dilemma that we're in this particular space, and then talk a little bit about some of the solutions that you're coming up with as an organization to build out a healthier pipeline and kind of get out of this rock and hard place position in terms of the financing of it.
This is such an important part of our health ecosystem that needs more and more and more attention. I think you've mentioned in your question, 1 in 5 people in this country have some type of a mental health diagnosis. 1 in 3 live in communities where we don't have enough mental health providers. I think we have one mental health provider for every 340 people in this country, and yet 1 in 5 people have a mental health diagnosis, just to give you a sense on the scale of the need there. And what we've learned over the years is that many people go through the program just like your son is going to go through, and yet every year we have about 47,000 masters prepared um, 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 clinicians or therapists that actually graduate, and then 57% of those never make it to licensing. Think about that for a moment. This is a discipline where we need a lot more therapists, and yet out of the 47,000 people who finish their master's program, 57% of those never make it to the licensing stage and end up being licensed so that they can provide services. So as we've learned about this, as we've learned to understand what are the drivers behind that lack of path towards licensure, what we've realized is some of the issues that you brought up. Many of these folks who are masters prepared have full-time jobs, have families to take care of, and then to ask them that, oh, now you need to do 2,000, 3,000, some are 4,000 hours of supervised services, supervised hours that might not be paid appropriately. They just simply can't afford it. Like it's just not possible for them to afford. For others, it's the tests you need to take to get licensed. And, maybe you don't have access to the prep schooling that you need or the prep programming so that you can pass your test from the first time. So how do we make sure that we provide the resources there? For others, it's the complexity of finding the supervisors. Like you're asking these master's prepared therapists to actually get all the supervision that they need, and that costs money, might not be available. You might have to find the exact right type of supervisor depending on your state. And then on top of all of that, add the super complexity of our system across the country, where every state has its own sets of requirements and supervision guidelines and what it takes to get licensed in that state. And then you get licensed in one state, and then you go to move to another state, then you have another layer of complexity in figuring out how to get your license in the new state that you're in. So this is just a flavor, Claudia, of some of what our master's prepared therapists are having to deal with. And for me, the challenge was, is there a way that we can make a difference to support these barriers, to support therapists who are going through these barriers and remove those barriers for them so that they can get to their licensure. So we started this program back in 2023, incredibly excited about this program because it brings those very concrete barriers and try to say, hey, how can we work with you as a master's prepared therapist to remove those barriers and get you to licensure? And what we've seen over the last 2 years, when we've started this program in Colorado and in Georgia, and we have now about 125 master's prepared therapists enrolled in this program. We've seen that this program is actually helping these folks, and we've seen an attrition rate of about 13% compared to 30% in other programs. We've seen these folks get to licensure. We're really excited about that. And because of the success of the early 2 sites in Georgia and Colorado, we've expanded this program now to Southern California, to the state of Washington, to Hawaii, and then we're launching in Oregon later this year. And I had a chance to spend some time, Claudia, with a couple of dozens of these master's prepared candidates in Philadelphia at the National Council for Mental Wellbeing conference last week. And I got a chance to hear their stories and hear how impactful this program has been in their journey to become licensed. And my heart is full from those conversations. It's just tells me how important this program is to supporting people getting licensed, and really how transformative this program is for those candidates, their families, and equally as important for the people who will benefit from the counseling that those therapists are going to be able to provide.